Good evening everyone, my name is Vicki Cope. I'm from the School of Nursing and Midwifery, and my topic tonight is titled Picture Perfect, Portraiture. So portraiture is a qualitative methodology which is an amalgamation of life history, narrative inquiry and ethnographic methods. It borrows its name from the visual arts and was developed by Sarah Lawrence Lightfoot, a Harvard professor who has a background in child development and sociology and education. It borrows its name from the visual arts, and I, as the researcher, will be developing written rather than visual portraits. So canvases, written canvases, rather than the canvas that, as you can see, is one's by Renoir and one in the naive form. As you can tell, these portraits are of the same child, but showing a tapestry of detail and different perspective. And that's what I will be doing with my portraits. And who am I going to portray? Well, because I'm a nurse, I'm going to portray nurses. Why am I going to portray them? When I began my PhD journey, the front page of the West Australian newspaper announced from the Director General of Health that the Western Australia healthcare system was in disarray. And I thought, oh my goodness, what's happening and why are the nurses staying? So, we know all that's wrong about healthcare. We see it every day. It's reported in the newspapers, it's reported in the literature. We have an ageing workforce. The average age of a nurse nowadays is 47 years old. We have chronic staff shortages. We do not have enough nurses. We are busily trying to prepare them in our undergraduate programs. We have horizontal violence and bullying. We have cutbacks and rationalisation of budgets, and you know with an election coming that there is the cut and pull of what is going to be spent on health. So why did I choose portraiture as my qualitative methodology? Portraiture as a methodology chooses to look at the positive. It looks at looking for success. It talks about people conquering obstacles and achieving success. So it's better to look for the success than the failures. Also, I postulate in my thesis, why are nurses staying in nursing, and I suggest that they are resilient. So using a framework of Fredrickson's broaden and build theory, I'm looking at how positive emotions and channeling those positive emotions and modelling those behaviours, nurses can remain within the system. Moen and Moen talk of survivor's pride, nurses overcoming challenges and accomplishing tasks to remain in nursing at the end of the day. So it's talking about Bandura's perseverance in times of obstacles, not giving up. And so that's why I wanted to look at nurses, develop their portraits and put it in a background of Western Australian health, something that's never been done before. So if a picture paints 1,000 words, and why can't I paint you? I'm saying that with my portraits, I in fact can give the words that will show the portraits of the nurses in Western Australia. Thank you.